A lot of times people are looking out for signs for people that are suicidal based on if they're looking good or whatever their depressive state is, if they're fun and happy. And you're like, well, I didn't even see it coming. There was no signs. I couldn't tell. I wanted to kind of like jump into that and hear your perspective of as far as like what you've seen. What are some of the signs that are there when you are depressed and suicidal, and like what are the differences?
So I think we have to start by saying like depression doesn't look like any one thing. There are symptoms that we as mental health clinicians can identify and diagnose people with depression, but that doesn't look like one particular thing. And depression in people of color looks completely different than it does.
How so?
And so like people often think of depression as like not being able to get out of bed or having like a low desire or not having any interest in things, which absolutely can be true. But when you are living below or at the poverty line, sometimes even getting out of bed, as much as it's a struggle, you still have to do it because you have to feed your family, you have to go to work. Also, depression can look like anger in some people. And so if you're a person or woman of color, a black woman or a black man, that may be the way that the depression exhibits, or your coping skills may just be angry or apathy. And people think that you just don't care about things, but that could be signs of depression. So I think learning about the differences in cultures and how it looks in different people is helpful for people to be diagnosed.
And that's a key word, especially because we're individuals, we experience pain, and our coping mechanisms are completely different.
Exactly.
However, I know people, it's such a daunting aspect to not be able to identify traits within somebody's suffering. Do you have like a baseline of what we could look for or be aware of when we have somebody that we know could be suicidal?
Yeah, I think I would say a baseline would just be to like name it. And so like even though everyone's different, even though I may not have like exactly what works for like 5 different people, I think I would just say like asking someone like, hey, are you okay? Hey, do you feel like hurting yourself? I think people think if they name it and introduce it to someone, it gives them the idea. And the reality of it is people may be thinking about suicide or have suicide ideation since they were little, since they were young, and they've dealt with it for 25 or 30 years. And that's just a constant, that's just their baseline. So just naming it and saying it, and I think if people became more comfortable with it, then those conversations could happen. But I would say things like having loss of interest in certain things. I don't even want to say being withdrawn, because like you said, people can be happy and like show you that they're happy, and they can still have those thoughts. And I think even recently, for the past few years, we've had a lot of examples of that through famous people that, you know, no one would see it coming just because of the representation, or how they present rather, but they still were dealing with that every day. So I think just naming it and like being there for people and letting them know that they can come talk to you. And then also recognizing when you as a layperson, so to speak, not a mental health clinician, you have a line and